All right, let's talk about some not-so-friendly visitors, musculoskeletal or MSK injuries like carpal tunnel and tendonitis. These are like the grumpy complaints our bodies make when we're not treating our hands and wrists very well. Ever experienced tingling and numbness or pain in your hands or wrists after a long day of typing or doing some repetitive task? Well, that's a warning sign. Carpal tunnel syndrome happens when the median nerve, which runs from your forearm into the palm of your hand, becomes compressed or squeezed at the wrist. This can lead to tingling, numbness, or weakness in the hands and fingers. It's like your body's way of saying, hey, we should really give these hands a break. Now, on the other hand, tendonitis is when the tendons in your hand or wrist become inflamed, often due to repetitive movements. It causes pain, swelling, and tenderness, which really makes it uncomfortable to move your hands and perform daily activities. The good news is that we can take steps to prevent all of these issues. By understanding the warning signs and making smart choices about how we use our hands, we can reduce the risk of developing carpal tunnel syndrome and tendonitis. All right, let's dive into the good stuff, making sure we prevent hand and wrist issues. I mean, there are some awesome ways to keep our hands happy and healthy, and we'll explore some simple tips and tricks to make that happen. First up, practice good ergonomics. Maintain proper posture and positioning while working or using tools and equipment can reduce the strain on your hands and wrist. This includes having a comfortable and supportive workplace, using ergonomic tools and equipment, and taking regular breaks to stretch and rest our hands. Use proper technique. Whether it's lifting heavy objects, using tools, or typing on a keyboard, using the correct technique can help prevent unnecessary strain on our hands and wrists. This means using the right grip, maintaining neutral wrist position, and avoiding awkward hand movements. Next up, take breaks. Giving our hands and wrists a break from repetitive tasks is essential. Taking regular breaks to stretch, move, and rest our hands can help prevent overuse injuries. Wear protective gear. When working with machinery, tools, or in possibly hazardous environments, wearing appropriate protective gloves can help prevent cuts, scrapes, and other hand injuries. Next up, strengthen and stretch. Engaging in hand and wrist exercises can help build strength and flexibility, which reduces the risk of injury. Simple exercises like squeezing a stress ball, wrist curls, and finger stretches can go a long way. Maintain a healthy lifestyle. Eating a balanced diet, staying hydrated, and getting regular exercise can contribute to overall hand and wrist health. It's also important to avoid smoking, as this can impact blood flow and increase the risk of hand and wrist injuries.